Our article basically focused on looking at applying a syndemic framework to cancer control and research in lower and middle income countries. As most of us know, the global cancer burden is increasing. And what we see is that not only that the global burden of cancer is increasing, we are also seeing that mortality from cancer is increasing as well, and more so in the lower and middle income countries. We were trying to look at a framework that could help us in addressing cancer control and research in lower middle income countries, because what we have seen is that in these countries you have a lot of inequities. Endemic framework was first coined by Meryl Singer quite some years back. It has been in use for the past 30 years and has been applied to infectious diseases mainly, but it has been applied to chronic diseases as well as conditions such as, let's say, immigration status or substance use disparities or health inequities can be a useful framework to address cancer control in lower and middle income countries. What we are seeing in lower middle income countries is that there is an increasing burden of cancer. And in connection with that increasing burden of cancer, you also have an increasing burden of non-communicable diseases like hypertension, diabetes, as well as another burden of infectious diseases like malaria, tuberculosis, and now most recently, COVID-19. Our findings indicate that if you use a syndemic framework, this can help in conceptualizing the different social behavioral factors that are responsible for clustering of these diseases or conditions in a population. This syndemic framework can actually help in not only conceptualizing, but also help in designing interventions that can address cancer control and research. Traditionally, what we have seen in lower and middle income countries is that cancer control and research is limited because of poor health infrastructure, limited human resource, trained researchers who can look at cancers and try to find out the underlying causes, and as well as look at the determinants of healthcare utilization for cancer. And we believe that using this sort of a framework that can not only look at why the disease is clustering, what are the factors for increased burden of cancers, including risk and prognostic factors, will be very useful for cancer prevention and control in lower and middle income countries. There are certain challenges related to the implementation of syndemic framework. First of all, it requires an interdisciplinary, or you could say multidisciplinary team of researchers that include sociologists, anthropologists, epidemiologists, medical doctors, nurses, as well as multiple data sources that can allow us to understand determinants or risk and prognostic factors of cancer, as well as post-cancer treatment outcomes. So these are the challenges that we face in terms of really addressing this sort of disparities that we see in lower middle income countries with regards to cancer control and prevention. This syndemic framework can be very useful. Our future plans is actually to apply this syndemic framework and evaluate this syndemic framework with regards to cancer research, prevention, and control. We aim to use cancer registries where we have some data on cancer outcomes as well as treatments, and also use some surveys that could be combined with the registry data to apply the syndemic framework and then use it to design interventions that can help us in cancer prevention and control.